Welcome back, folks. We are on our last case study, last drug of our course. After this, it's time to move on to working for a few days on our final projects. So the last drug we're going to discuss is sodium pentothal. This might be the only drug in class you have not heard of yet. We'll talk about its history and the current use. I will have this content warning, folks. The slide deck does contain reference to capital punishment and the death sentence. So before we get to our understanding of sodium pentothal, we have to understand the history of anesthesia. If you've ever undergone something more intense than minor surgery, you might have experienced anesthesia. In history, many cultures used analgesics to kind of lower the pain being felt by someone, or some type of sedative. For example, many cultures used alcohol, beer, wine, for example. Some used opium or acupuncture to help people kind of cope with pain. In 1846, we have the first use of a chemical called diethyl ether as a general anesthetic that's going to be putting someone to sleep so that they can undergo surgery, right? The point of anesthesia is to kind of make someone unconscious so that they don't feel the pain that might occur during the surgery. Now, diethyl was synthesized way back in 1540, and its medicinal properties were noted at the time, which is why it began being used in 1846 as a general anesthetic. However, as a chemist, of course, I must point out that this is not an ideal chemical to use for anesthesia because it's highly flammable. So, as electronics increased, right? Electric lighting, for example, having electricity in the presence of something highly flammable is dangerous. If something like a spark were to occur, you do have the danger of the diethyl ether lighting on fire and causing something like an explosion. Now, ether is not the only example of an anesthetic that was kind of inhaled to have the person fall asleep before a surgery. There's also chloroform, nitrous oxide, but some of these other inhalation-based anesthetics resulted in nausea, so the patient would wake up and experience kind of lingering nausea for the rest of the day. So chemists were trying to come up with better alternates for anesthetics. And in the early 1900s, we see a class of chemicals called barbiturates first synthesized and their uses discovered. Now, these anesthetics could be taken orally, and at the time, they took more than 20 minutes to work, right? So more than 20 minutes to get a patient asleep, which was an improvement compared to other types of anesthesia at the time. These were also fairly short acting, so they would work on like a very quick type of surgery, but for a longer surgery, they were not appropriate. So at the time, right, these barbiturates were actually quite a success. They took only 20 minutes to work. And while they only worked for a short period of time, short acting in a way was good because then the patient could recover from the anesthesia quickly. After the success of this class of compounds, chemists went to synthesize many more similar compounds and tested them. And so in 1939, we have the discovery of the chemical sodium pentothal. These chemists were searching for a fast-acting IV anesthetic, so something they could directly administered to a patient through an IV line. Sodium pentothal was exciting for physicians because it had a near immediate onset, right? Remember that we were excited that we had a 20-minute time of onset. Well, this was near immediate, which is excellent for surgeons to be able to perform a surgery quickly and get that patient taken care of. Sodium pentothal was also ideal because it was kind of released by the body fairly quickly, so the patient would suffer kind of fewer side effects because the drug leaves their system in 12 hours. However, sodium pentothal, while being effective, really only lasts anywhere from 3 to 5 minutes. So again, it could be used for very short surgeries, but oftentimes had to be used with other anesthetics for more prolonged procedures. So sodium pentothal, with this discovery, became the most common anesthetic to kind of prepare patients and help them fall asleep at the beginning of a surgery. Since it only lasts for a very short period of time, it was used in conjunction with other types of anesthetics for longer procedures. Now, after it was discovered, since it was becoming so commonly used, we were also discovering that it was easy to misuse. So in World War I, sodium pentothal was used pretty frequently because if a soldier was wounded, we could really speed up that time to surgery since it took effect almost immediately. However, many patients ended up dying because the physicians using it were not experienced in dosing the sodium pentothal, or they mistakenly would use it for longer than the 3 to 5 minutes that it acts. So they would end up kind of giving the patient a toxic dose because they were using it for longer than it was intended to be used. And so there was kind of a lot of learning that happened around that time to kind of improve its use as an anesthetic. Then in 1954, the patent for this molecule expired, making it much cheaper to use. And at this point, it basically becomes widespread for its use as an anesthetic in surgery. As a side note, it was also used in therapy to put patients in a more kind of relaxed or sedated state. And so since it was being used in this way to sedate patients in therapy, people got, I guess you could say, creative. So in comes kind of this understanding of sodium pentothal as a potential truth serum. What do I mean by that? So in the 1940s, one example of its use was to interrogate a suspect for an attempted burglary. This 17-year-old person who was a suspect was injected with sodium pentothal, and in this kind of relaxed state, he confessed to a large number of crimes, including 3 murders. However, after that incident, when he was dosed with sodium pentothal, until his death in 2012, he maintained his innocence. And so it is kind of suspected that this confession was coerced in this kind of sedated state that they put him in when they gave him sodium pentothal. To kind of show that the use of the drug in this way is no longer acceptable, sodium pentothal was later banned by police departments for use in interrogation, so it is no longer allowed. But the history of sodium pentothal kind of goes very deep in the United States. There was a 1964 operation called MK Ultra, where the CIA used sodium pentothal as what they thought was a truth serum to interrogate prisoners during the Cold War. And after an investigation, the CIA was eventually accused by Congress of abuse through its use of sodium pentothal. and it was used as recently as the 2000s to interrogate people accused of terrorism. And with what we know about the use and misuse of sodium pentothal, certainly it is controversial that it was still being used as late as the 2000s. Up next, we'll transition to the use of sodium pentothal in lethal injection.